So today our topic is known as livor mortis, and there are many other names which were given to the livor mortis. It is also known as post-mortem lividity. It is also known as hypostasis. So whatever the name comes in the exam, you should know that all of these are the synonyms of livor mortis. Livor mortis, postmortem lividity, and hypostasis. These are the frequently used name for this phenomena. Anyone knows about it? जी बेटे क्या होता है इसमें? Not on the contact. Contact पे तो नहीं होगी ना? Dependence पे होगी, ठीक है? So basically there is a phenomena because of which normally this situation happens where you see a specific type of staining which is firstly in the motile dots and then progressing to patches and then it got fixed. So the main reason behind it is that the capillaries and the other venules and all the things becomes toneless after death. Okay? Similarly, the circulation of the blood heart stops circulating the blood. So the accumulation of the blood in that toneless capillaries due to the gravity, due to the stoppage of the blood, results in staining of those areas. So it is basically टोनलेस होंगी कैपिलरीज, लेकिन कैपिलरीज आर इंटैक्ट इन दैट केसेस. ठीक है, जब आप कट करके देखोगे तो ब्लड ऊज आउट नहीं होगा और जो थोड़ा सा हो रहा होगा अगर आप उसे वॉश करोगे तो वो वॉश भी हो जाता है इजीली. ठीक है, सो द मैकेनिज्म बिहाइंड इट, these are the names which is normally used as postmortem staining is also used. The learning objective of today is that we should know what is basically the postmortem staining or lividity, what is the mechanism behind this. Then we see that what are the basically different type of colors of lividity, different situations where the lividity color is different, progression of the lividity, it starts from where, goes where, when it got fixed, how are you determining it is fixed. Then effects of changes in the position after death, like for example you are supposed to have lividity a specific area and you find the lividity on another area. From that you can understand, okay, that the body has got changed its position after the death because by some person. ठीक है, तो वो lividity आपको बहुत उसमें specifically बताती है. टाइम सिंस डेथ आपको बताती है, अगर वाटर में बॉडी है उसमें लिविडिटी किस एरिया में आएगी. Internal appearance, factors affecting and time of appearance and fixation is very important for the determination of the postmortem interval. Medical legal importance आपको क्या पता चलेगी इसकी वजह से, and the differential diagnosis of lividity. So this is all about, और इसमें each and every topic of lividity is very important. Sometimes a full-fledged note on the postmortem lividity comes, sometimes some scenarios there, sometimes very little small MCQs from it. For each or everything which we have discussed in our learning objectives is very important from the postmortem lividity.
If you like my video, please subscribe to my channel and press the bell button to receive all the notifications. And my channel name is Dr. Javed Iqbal Kokar, Lectures on Forensic Medicine.